Hello, my name is Gwyneth Hinds, and I want to talk today about women who have had history of breast cancer and HRT. Now, this is something that's very close to my heart because I worked as a breast surgeon in Belfast City Hospital for 14 years. The majority of women get breast cancer over the age of 60, but there are some women who are unfortunate enough to be diagnosed with breast cancer in their 30s and their 40s. And for a lot of those women, their treatment is going to actually maybe put them at increased risk of going into an early menopause. And if they have got a tumour that is sensitive to hormones, then they're going to be put onto hormone therapy. And that hormone therapy may well then produce the symptoms of a menopause. So it's almost as if it's a double whammy, because then they may be going into the natural menopause and they're told you can't have HRT. And I think it's really hard for women who are struggling, not only have had a breast cancer diagnosis, but then are struggling with menopause symptoms, if they go to see their GP and they're told you can't have HRT, end of story. So if you've had breast cancer and you're struggling with menopause symptoms, you deserve the support and the information and treatment just as much as every other woman. And there are treatment options that are available for you. Now, not all breast cancers are equal. There are some breast cancers that aren't as sensitive to hormones. So we talk about triple negative breast cancers, in other words, estrogen, progesterone, and HER2 negative. So if you've got a triple negative breast cancer, and you're more than 5 years from your diagnosis, the risk of you getting that breast cancer coming back is actually really very small. So that might be a case where talking to your oncologist, talking to a menopause expert, that they may be prepared to discuss whether or not HRT would be suitable for you. But if you've had an estrogen receptor or an estrogen receptor positive breast cancer, then the majority of the times your oncologist and your menopause expert is going to say, look, this could put you at increased risk of your breast cancer coming back. But it's also important to remember there are other factors that will put you at risk of your breast cancer coming back. And if we want to reduce the risk of our breast cancer coming back, then we have to think about maintaining a healthy weight, taking regular exercise, and not drinking too much alcohol. And I would suggest no more than 10 units a week is the sort of level we need to be thinking about. So it is a risk factor. But whenever we're talking about risk, we also have to then balance that up with the benefits. And if you're absolutely miserable with terrible menopause symptoms, then you may decide, actually, I do want to try HRT, or at least I want to see if I can try HRT. So you want to then talk to your oncologist about what are the risks of your breast cancer coming back. Did you have a very small breast cancer that was successfully treated 10 years ago, or whether or not you had a node positive breast cancer, maybe it was diagnosed within the last few years. So it is something that needs to be discussed with your oncologist. The one bit of good news is that it is safe to take vaginal estrogen. That vaginal estrogen will help to reduce the symptoms of vaginal atrophy and dryness. And that for all women, even if they've had breast cancer, that is going to be safe to use, because the estrogen is being inserted into the vagina, is working locally and reducing those symptoms, and very, very little is absorbed into the general circulation. One of the experts for the British Menopause Society said at a conference that if you're using vaginal estrogen for a year, the amount of estrogen that's absorbed into your general circulation is the equivalent of taking one oral contraceptive pill in a year. And I think we can all realise that one oral contraceptive pill in a year isn't going to bring anybody's breast cancer back. So what are the other non-hormonal treatments that are available for you? And there are different types of drugs that have research that has shown that they will reduce the severity and frequency of hot flushes and night sweats. They're not going to make as dramatic a difference as estrogen replacement will, but they will reduce the symptoms and maybe make them more bearable. And there's a whole range of different drugs. Gabapentin is one of them. And then we've also got antidepressants. And there are different types of antidepressants that have been shown to reduce the severity and frequency of hot flushes. So if you go to your GP and you've had breast cancer, he suggests putting you on antidepressants, don't think, oh, he thinks that, you know, I'm just depressed. That's not what he's using it for. He's using because there is evidence that these drugs will actually help reduce the severity of the hot flushes and night sweats. And again, quite often low mood and panic attacks and anxiety can also be symptoms of the menopause. So those antidepressants may actually help those symptoms as well. You're probably going to need to try it for at least 3 months before you will see the full impact of it. Again, it's interesting in that there's a drug that is undergoing research at the moment in America, which is working in the same sort of level as the antidepressants. In other words, it's working in the brain and the levels of chemicals within the brain. And there's very encouraging research that this new drug will actually reduce the hot flushes and night sweats significantly. Now, it's not going to have the other benefits of HRT as far as reducing osteoporosis is concerned, but maybe within the next couple of years, that drug may well be available in the NHS and could be a real game changer for women who have had breast cancer. There are other things that we can do to help reduce the severity of menopausal symptoms, maintaining healthy weight, being active, taking 30 minutes of exercise a day, and eating a healthy diet. If we are eating lots of plants, we're not just talking about fruit and vegetables, but also the pulses and the nuts and the grains, that's actually going to reduce the inflammation in our system. It's going to actually help our gut microbiome. And all of these factors are very important for estrogen metabolism within our body. And it's going to have other benefits for our general health. And it's going to help to offset some of the health consequences of the menopause. So women who've got breast cancer are worried because, you know, they'll hear people talking about HRT, that it's good for your bones, it's good for your heart, and it's good for your brain. Yes, it is. But those other things, exercise, maintaining a healthy weight, eating a good diet, and not drinking too much alcohol and not smoking, are all things that are going to have a much greater impact on reducing your risk of heart disease, dementia, stroke, diabetes than HRT will. And then as far as osteoporosis is concerned, if you've had breast cancer, you will be getting your bone density scan to see what your bone density is like. And if need be, then you will be prescribed calcium, vitamin D, and other drugs that can help to protect your bones. So if you've had a breast cancer diagnosis and you're suffering with menopausal symptoms, then speak to your GP. Ask maybe to speak to your oncologist again, and ask to be referred to a specialist in the menopause, because you're the ladies who need that and need that additional support.